Through CHI's ePharmacist direct service, registered clinical pharmacists who work from a central hub in Fargo, North Dakota, serve as an extension of on-site care teams at remote hospitals in North Dakota and Minnesota. ePharmacist Direct helps hospitals provide safer and more effective care, enhances on-site pharmacy services, and eases the challenge of recruiting clinical pharmacists to work in remote locations.
ePharmacist Direct currently provides service to 17 rural hospitals in the states of Minnesota and North Dakota. It's quite important to these facilities because regulatory agencies are getting much more stringent about regulations where every medication order is reviewed by a pharmacist prior to a medication being administered to a patient. Most of these hospitals are unable to afford to pay their own on-site pharmacy staff for those kind of schedules, as well as even have availability of pharmacists that they can hire. So having access to our service really changes life for patients as well as nursing staff and the other healthcare practitioners at those sites.
I live in a rural area and our pharmacist is not always on duty. We just have access to one pharmacist, and by having the e-pharmacy, we are able to provide 24/7 pharmacy coverage to the patients at the hospital. They're able to provide this service which helps answer questions to pharmacy technicians like myself, and the doctor will sometimes even have questions on allergies and if certain medications can be given with these allergies.
The process really happens like this. The nurse or ward clerk from the facility, from the hospital, will fax or scan an order into a system that will reach the telepharmacy site. From there, we immediately take those orders, review them for safety, review allergies, review patients' lab work if necessary. In the meantime, the nurses at the hospital removing medications from a stock supply potentially or from an automated dispensing cabinet, that nurse will bring those medications to the camera, and we will visually review those medications with that nurse prior to he or she administering them to the patient. Once we know that the nurse has indeed pulled the correct medications, he or she is free to go to the patient room, and that patient will receive his or her medication in a timely manner. A typical day will bring us about 600 orders that we would be keying into a system or onto a patient profile. We would probably be visually verifying an average of 60 medications per day over the Polycom equipment, and we average about 15 interventions per day. Interventions meaning anything that would be a recommendation regarding the patient's therapy or a request for clarification on an order, prevention of incorrect dosing, those types of things. Even though geographically we see quite a bit of distance between some of our sites and our central site, our team feels very connected to these sites, and they feel very comfortable with our staff. They get to know each other, particularly through communicating over the audio-visual equipment and even just simple phone calls. They really have gone from being sort of out there on their own during the night especially to actually having somebody at the other end of the line. So you do really become part of the team at every single facility. The concept has really caught on, and it's becoming very popular. Our service in particular is planning to expand into multiple states. The staff that work for our team here have really been folks that are looking for something more rewarding than what they've been doing, more directly affecting patients. It's an extremely rewarding feeling as you walk out the door at the end of your shift.